Hello and welcome to One India. You're watching Meet the Game Changers, a One India special that brings you face to face with innovators quietly reshaping India's future. Across sectors, there are organizations challenging broken systems, questioning legacy models, and placing people back at the center of progress. Today, our focus is on healthcare, an area where access, affordability, and trust remain critical national challenges. We are in conversation with Superhealth, a healthcare platform that is rethinking how hospitals function in India from the ground up. Superhealth is redesigning hospital care by putting patients and doctors back at the heart of the system. With full time senior doctors, world class infrastructure, advanced AI driven systems, and a zero commission model, the company is building a planned network of 100 hospitals focused on simplicity, transparency, and trust. For families, SuperHealth's VIP Pass simplifies access to care, covering up to 4 members with unlimited doctor consultations, along with tests and scans prescribed by SuperHealth doctors, including MRIs. Joining us today is Varun Dubey, founder and CEO of SuperHealth. Varun, welcome to Meet the Game Changers.
Hey, thanks, Pankaj. Thanks for having me on the show.
Pleasure. Varun, first things first, given the scale of this country, India faces a shortage of nearly 3 million hospital beds, which is hopping. Even as healthcare costs continue to rise, this is the most concerning part here. How is SuperHealth addressing both access and affordability through its low capex, venture scale capital hospital model?
I think it's a very good question, Pankaj, and it's a very important problem as well. If you look at, India, like you said, has about 3 million bed short. And if you look at a typical corporate hospital, because that's in India, corporate hospitals really is where very high quality care is delivered in India today. That quality of care costs about 2 crores a bed to make today, right? So if you are about, say, 30 lakh bed short, 2 crores a bed, you're looking at, I don't know, maybe around $600 to $700 billion of infrastructure investment, which is significant, right? And this high capex is fundamentally the original sin of healthcare, in my opinion, because this increased high capex is what then skews the model, focuses everything on revenue, it focuses people return on capital. That drives the incentive model, that drives the commission model. That is what causes huge lines in hospitals. You're trying to put as many patients in the same hour of consultation as possible. It also leads to a lot of bad things like overprescription of medicines and tests. And of course, a lot of surgeries get done, which people don't really need.
Right, absolutely.
So what we are trying to really do, and also, by the way, if you see over the last few years, billions of dollars from private equity has also gone into hospitals. But what is happening there mostly is consolidation. Right? So there is hospital A buying hospital B. So it looks like hospital A is increasing its beds, but in reality, total bed count of India is staying the same, right? Because they're just buying another hospital and changing the logo on the beds.
Right.
So what India really needs is an expansion of bed, but we can't obviously afford 2 crores a bed cost to do 30 lakh beds. And what that really means is that the cost of bed has to come down. So what we are doing is changing the fundamental model of delivery by delivering the same or better quality of care that you get in a corporate hospital, by building hospitals that are 65% lower capex.
Okay.
Right? We do that by doing a lease and rapid construction model. So we do long-term leases, right? Because the building doesn't decide the quality of care in many ways.
In our conversation, it has come almost 2 times that quality care, that is something, and that too at affordable cost.
Right.
Premium healthcare, if we may call it, is something that is out of reach for most of the Indians, and this doesn't take much, to understand it. SuperHealth claims to deliver quality care at 65 to 70% lower cost. You explained that, how your investment is being managed from that side as far as the cost is concerned. But how is this achieved without compromising the patient outcomes, the quality given?
It's a great question. Actually, our model enables even better patient outcomes. Let me explain, right? So the way we do healthcare delivery today, like I was saying, a very large part of the cost of the delivery of care goes into things that have nothing to do with care quality. Okay, let me give you a
Mm-hmm.
simple example. Let's say you buy a piece of land, in Gurgaon,
Mm-hmm.
and you buy it mostly recently somebody bought it on Golf Course Road. Typically big hospitals require 2 to 3 acres of land,
Right.
right? You pay about for that you pay about say 700-800 crores for just the land.
Mm-hmm.
Okay,
Mm-hmm.
and then this is a real case. They've been in litigation now for the last 3 years. So
Right.
10% cost of capital is another 250 crores for 3 years. Just cost of capital
Mm-hmm.
because the land is just sitting there while you're litigating. And obviously, if you want to buy 3 acres of land in a big city today, mostly it's available because there is under dispute of some kind. After they settle the dispute, it'll take them at least 3 years to make the hospital. So that's another 250 crores of capital cost, right? So before a single bed or brick has been put in that hospital, you
The
have already
cost is
spent
escalating.
1,300 crores, right?
Right.
Then they will actually spend 400-500 crores to actually make the hospital, put the devices and everything. Let's say that takes
Mm-hmm.
the project cost to about 1700-1800 crores, right? Even if you make 800-900 beds, you're still looking at 2 crores a bed, right? But the
Right.
first 1,300 crores that you spent had nothing to do with the healthcare quality for the citizens. It is just that
Mm-hmm.
somebody decided to put a hospital in that location and decided to litigate for 6 years, right? So if what we do is we remove all of this cost, the first
Mm-hmm.
1,300 crores we remove, right? And that we pass on that saving to the customer. So the customer gets it at 50% lower price than a typical corporate hospital surgeries at Superhealth, right? But we spend the same or more on money on actually things that matter for your care, right? The devices we use, the nursing teams we use, the doctors we hire. So the
Mm-hmm.
savings we have here, we actually put it into the things that actually matter in your care. So we actually deliver, therefore, higher quality of care.
Your 1999 rupee plan, it's an annual subscription which offers a family of four unlimited
Mhm.
consultations, tests, and advanced scans like MRIs. How does this model change access to the healthcare, first of all? And secondly, how is it financially sustainable?
Right? A lot of people today in the country, all of
Mm-hmm.
us, do a lot of self-medication
Mm-hmm.
simply because it's too difficult to go and see the doctor, right? There is long wait times.
Mm-hmm.
It takes hours to see them. They will not see you for enough time because they don't have the time because they have to see 100, 200, 300 patients, within a few
Right.
hours.
Mm-hmm.
So these are all problems that they have. What we wanted to do was really simplify this experience for our customers. So we did this OPD subscription where the family gets taken care of if you come to Superhealth, and you can see the doctor as many times as you want. And
Okay.
if our doctors prescribe you a test, we cover it, even if that means it's an MRI. Because if you think about it, what is really the incremental cost of an MRI, given that I have to put an MRI in my hospital anyway? Because we are a multi-specialty hospital, so we obviously do surgeries like knee replacement and hip replacement and so on. So the incremental cost essentially is electricity, right?
Mm-hmm.
And I agree that electricity is not necessarily cheap, but it's not as expensive as I have to pay for the entire MRI from that one scan.
Absolutely, absolutely. And that's the differentiation that one must draw, that it's a hospital and not a reality sector booming, prospects that one would look at. You mentioned, Varun, about OPDs and IPDs. Traditional hospitals, where we have been
Mm.
going so far, they depend on heavily on OPD to IPD conversion and
Right.
occupancy-driven revenues. By removing
Yes.
this pressure, how does Superhealth empower doctors and improve the patient outcomes, which is vital?
The way we do it really is that we enable our clinical teams, and we spend a lot of time thinking about and working with them to actually do the clinical SOPs, the operating procedures.
Mm-hmm.
That leads to a lot of improvement in the clinical salience. For example, at Superhealth, we spend a lot of time worrying about drug-drug interaction. Right. So in many hospitals, there are manual teams that are doing this, and obviously that is prone to error. Superhealth is a 100% digital hospital because our AI systems actually write the prescriptions as the doctor and patient have a conversation. It's a systems that we
Mm-hmm.
have built. It's called Super OS. And because of that, our systems are able to automatically catch any drug-drug interaction that might happen during the course of a treatment, which is materially safer for you, right?
Right,
This is a
right.
very, very manual process in most of the hospitals today, but it
Mm-hmm.
has a material impact on your outcome. Our doctors, like I said, obviously, have a lot of technology available to them for using this. So I'll give you a very simple example. One of the things that we do is from the time you enter Superhealth, everything that is an input into your healthcare is digital, which means that we have almost always 100% data about you for the visit from the OPD
Right.
to the IPD and so on.
Mm-hmm.
And what that does is that our clinical systems are comprehensive, right? So whenever a doctor or any person looking at your care looks
Mm-hmm.
at the information for the patient, they always have
Right.
100% up to the second, right? So
Mm-hmm.
they can
Mm-hmm.
actually see what happened. Dr. A came and prescribed something. Dr. B comes later and sees, he can see exactly what doctor prescribed. There is no lag, right? Because the prescription
Mm-hmm.
happened on the system itself. And mostly in many ways, it gets done by the AI systems. Doctors just kind of talk to it.
Okay. Okay.
This also leads to a lot of improvement in how we do patient monitoring. So, as an example, we've built some systems in house which actually monitor the patient live and do charting live, and they send updates to the doctors live. So the
Mm-hmm.
treating doctor or surgeon always has the access to the latest records as well, without actually having to go in some complicated menu somewhere and seeing it. They actually get it like a
Mm-hmm.
push alert into Slack. All
Okay.
our doctors use Slack at Superhealth, and that's what how
Mm-hmm.
the care gets managed. So it's super in sync. It's
Right.
super super efficient.
Absolutely. And I would say, Varun, the points that you mentioned, a lot of them are the distinguishers from the legacy hospitals that we have been visiting so far. And legacy hospitals are often, I would say, criticized for prioritizing occupancy and profits over patient experience. How does Superhealth's UX first approach, including what you mentioned, the initiatives like Honest Second Opinion, they redefine trust, especially for patients considering surgery?
Mhm. See, our goal with Superhealth at a very high level is very, very simple, right? Can we build hospitals that we are proud to recommend to our friends and our family and our loved ones? Okay, a hospital where I am not afraid if my mom goes alone without me. Okay, this is our
Right.
bar. The hospital has to be mom approved. Okay, that's it.
Right, right,
That's a
right.
very high bar. So we think of these things very differently. And I'll give you a very simple example of this, right? So, because of this philosophy, right, we have not really built an app for Superhealth because we
Okay.
know that when you require healthcare, you want to talk to a real human being. So there is a lot of AI at Superhealth. Zero of that AI is patient facing.
Okay.
At
Okay.
Superhealth, you always
Uh-huh.
talk to an actual human being who has context about your condition as our concierge care service. So you can book an appointment on the website if you want, or you can just call the helpline and they will help you book the appointment with whoever you want, whenever you want. They can book your test. They can give you medicines. You walk in. There is no registration desk. There is no reception. You walk in. You get met by a concierge care person, kind of like what happens in an Apple store, and then
Right,
they can
right.
do anything for you. We don't have a billing counter. We don't have a billing desk. We don't have an admission desk. So patients don't run anywhere. They sit in one location and everything happens to them there. And then they go home.
You described Superhealth as being built at the intersection of design, technology, and infrastructure. Fair enough.
Mhm.
How does this fundamentally differ from the legacy hospitals? And do you believe doctors themselves are constrained by the current healthcare system, if we may look at
Yeah,
it,
I
please?
100%. See, every single doctor that I have ever met, and that is thousands and thousands of doctors in the last 10 years, they want to do everything possible in their power to do the right thing for their patient. Okay. I have not met a single doctor who didn't want the best thing for their patient.
Right.
The
Fair
problem is
enough.
that they are as stuck in the system as the patient is. So I think absolutely in the current system, doctors are constrained from doing the best thing. By the way, they try very hard. All of them do everything possible despite significant complications and limitations that get placed around them in most places. And yet they try to do the right thing for the patient. So I think they're doing everything they can, but they are also kind of tied in. So there has to be an alternate system that allows them to be doctors. So, I keep saying that, there has to be a system that basically frees the doctor to be a doctor. That is what he trained for. That's what we are
Absolutely.
building. So that's kind of like the other part. In terms of, the other thing that you were saying about the design, right? Yes, we fundamentally design hospitals differently. We are as much a technology company as we are a hospital design, build, and operating company. So it kind of
Varun, this is something that I would say is eye opening, enlightening also, and awareness that is needed, not just in the medical fraternity, but otherwise also. And looking at the skyrocketing costs and the effort to keep your loved ones safe, becomes, more and more unaffordable, Superhealth, I believe, has the answer to it. Thank you so much, Varun, for speaking to One India and sharing your views.
Thanks, Pankaj. Thanks for having me on. Take
Thank
care.
you. Thank you. So that was Varun Dubey, founder and CEO of Superhealth, sharing his vision for reimagining healthcare in India. Thank you so much, viewers, for watching Meet the Game Changers. Stay tuned to One India for stories that matter.
India and never miss an update. Download the One India app now.